After treating hundreds of patients who had either a hip or a knee replacement performed, there are three things that I wish every patient knew before they had the surgery that would have made their recovery so much better. The first thing that I wish every patient knew before going into surgery is that the very next day after surgery is typically going to be one of the best days that you're going to have related to pain. The day after surgery, you're typically not going to have that much pain and you're going to feel pretty good because with those joint replacements, so the hip or knee, you're typically going to be going under anesthesia, and those effects from the anesthesia are going to carry over into the second day, so the day after surgery, and you may have essentially a higher pain tolerance. You're not going to be feeling much pain because those effects of the anesthesia are still in your system and are yet to be depleted from your system. Now, the issue that comes along with the day after surgery is, for example, with a knee replacement, because you're not going to be feeling too much pain for most people, you're going to feel like you can do more than what is safe to. But the day after surgery is it's crucial because your skin, the joint itself, there's a lot of healing with those soft tissues that is occurring the day after surgery. And if you do too much, for example, if you try to bend your knee a little bit too much and it's not ready for it, you can risk possibly opening up or making the incision not close or heal optimally just because you're doing too much too soon, because your pain level is on the lower side with some of the anesthesia still within your system. So please be aware that the day after surgery, a lot of patients are typically going to have or feel like they have less pain, but that's not a green light to do more. That's just feeling the effects of the anesthesia. So make sure you still take it easy the day after surgery, but I wish people knew that a little bit more, that the day after surgery, you're going to have less pain levels. So just be careful with how much you're moving and what movements you're doing specifically. The second thing I wish people knew is that bruising and swelling are part of the inflammatory process after joint replacement, and it's normal to have both of those symptoms. So don't be freaked out, don't be concerned if you're having bruising or swelling around that joint or even below. So with individuals who had a hip replacement, they can even have bruising and swelling go all the way down to their feet just because of certain positions and with gravity bringing fluids down the leg. Now, we try to reduce the amount of inflammation and swelling you have by doing icing, elevating that limb, so that way the inflammation, the swelling, doesn't go too far down the leg, and you kind of keep it more central, so where your body can get rid of that extra swelling a little bit better. Now, with the bruising, like I said, that can be in different areas. So even if you had a knee replacement, you might have bruising around the thigh, the back of the thigh, the front of the thigh. You can have it around the ankle. Even if no damage was done at the ankle, sometimes the gravity will pull down the fluid, pull down bruising. So don't be alarmed if you have swelling and bruising. Also, you may not have the bruising immediately after surgery. So I've had patients who didn't see bruising or notice that symptom 5, 6, maybe even 7 days after the surgery. It can be delayed, and that doesn't mean it's a red flag or something to be concerned about. It's just sometimes it can just come a little bit later. Now, as long as typically earlier on, you're going to be having sessions with a home health physical therapist where they can monitor any of the concerning types of symptoms related to DVT, so a painful calf, a higher temperature around the calf region, right? So where if you have a lot of tenderness in the calf, that can be one of the symptoms of a DVT. So as long as those things are ruled out, it's very common for people to have swelling and bruising, and it can be delayed for even for a week after the surgery. So just don't be alarmed, and you should expect to have some of those symptoms. The third thing that I wish all my patients who had a hip or a knee replacement knew is that just because you feel like you don't need the walker anymore and you feel that you can walk around or stand just with the cane, that does not mean you're ready. So when we're talking about transitioning the different assisted devices, so if you're going from a walker, a front wheel walker, to any kind of cane, that needs to be essentially approved, and you need to get that checked off by your physical therapist that you're, one, you're meeting the appropriate requirements and kind of like the guidelines that are necessary to transfer you from the walker to a cane. You have to demonstrate specific pain symptoms, specific range of motion, or even your gait mechanics have to be a certain way where you're safe and appropriate to use just a cane. So with a cane, typically, even if it's like a quad cane with the four legs on the end of a cane, they're not going to be as stable as the walker, and you're not going to be able to weight bear into a cane how you weight bear with the walker. So if you're walking with a limp while you're using a walker and now you just feel like you can use the cane and you're walking with a limp, but you can technically get around like your home, let's say like from your living room to the bathroom with just a cane, and you can feel like you can do it without anyone helping you and you can manage, right? But your limping or your walking is kind of not the typical gait pattern or the normal walking pattern that you would walk with. So there needs to be certain requirements and goals related to your pain and your function that are met before you go from the walker to a cane. Now, one of the consequences of going from a walker to a cane too soon is that because you're not able to weight bear using the cane as much, you're going to be weight bearing a lot in your opposite leg or on the actual surgical leg more than it's ready for, which can cause more inflammation, so more swelling and more pain symptoms in that surgical hip or knee. So that just prolonged your recovery that much longer, all because you wanted to use just a cane for whatever reason. Maybe you just don't you think, and this is a common thing I'll hear is people will say that the walker, it gets in the way, it's like tight spaces in their home, or they just don't want to be seen with the walker. But unless you're cleared by your physical therapist and your orthopedic surgeon that you're moving well enough and have good pain tolerance to standing and walking that you can transition, you shouldn't go from your walker to your cane too soon. You have to meet certain requirements. So if you just be a little bit more patient in your recovery and you wait to change assisted devices once you're told to, your recovery is going to be that much better and your pain is going to be better if you just wait.